Hello everybody, this is Larry. This is my channel on living with stage 4 metastatic prostate cancer. And yesterday, April the 17th, I had my 6-month checkup with my radiation oncologist, Dr. Alite. I think I mentioned before that he's my go-to doctor. He's the one who listens to me. He's he's the guy who found who wrote the order for the PET scan, which found the tumor in my right lung. He's also the one who, after I complained to every doctor I had about neuropathy in my feet and legs, he wrote the MRI which found the meningioma in my spinal cord, which when it was removed in January, I have much better feeling now. And at this point, I'm going to beg for, subscribers. So please hit the subscription button and the like button. It just gets my videos out to more people, which is important. Anyway, talking to Dr. Alite, this time our discussion sort of swerved over to metastasis. And in my case, my cancer had metastasized. What the PET scan found was it was in my right lung. And I always thought that, I thought I had read it somewhere that metastasis usually went to your lymph nodes. Then it could be no, it was your bones and then your lungs. But he straightened me out on this, and here's what it amounts to. I also went ahead and checked on Google, which everything he told me is confirmed. But prostate cancer can metastasize to several areas of your body, including your bones. That's the most common one. Cancer can spread to any bone, but typically it affects the bones in the spine, pelvis, and ribs. The second most common area of prostate metastasis is your lymph nodes, and those are the small structures that help fight off infections. The third most common place is your liver. Although it's less common than the bones or the lymph nodes, prostate cancer can spread and does spread to the liver. The fourth place is the lungs. That's the fourth most common place. And it's less common than your bones, lymph nodes, or your liver. And then the last, the fifth place that's most common for prostate cancer to metastasize is your brain. And that's kind of rare, but it does happen. And it's important to note that prostate cancer also metastasizes to other organs and tissues in the body. But those 5 that I told you were the most common ones. And I also reviewed my progress with Dr. Alite because I try to keep him up to date with everything that's going on with me. Like I said, he's my go-to guy. He does listen, and even though it's there in my Geisinger report, he's another Geisinger doctor, which are almost all of them are. I like to keep him, in tune with what's going on. I'm sure he has a bunch of other patients, but I do try to keep him up to date. So I was thinking about this quote I had read. It's an oldie. The quote is, "It's better to light a candle than to curse the darkness." It's a proverb that's been attributed to various sources, but the exact origin of it isn't really known. But I think that's, it is better to light a candle than curse the darkness. I think that's especially applicable to cancer patients, metastatic cancer patients. It's better to, instead of complaining about the dark situation you're in, it's better to take actions and do something positive to improve it. Just like lighting a candle provides light and clarity to a dark room, taking action can bring hope and solutions to a difficult situation. So If you have stage 4 metastatic prostate cancer, or someone you love has stage 4 metastatic prostate cancer, light a candle. Stay in the game. And we're going to do that. I'm actually going to light one. This is, of course, symbolic, but here we go. Without burning myself too much. There's the candle. So stay in the game. Stay positive. Enjoy your family and friends. And keep a candle burning. Peace. And I'll see you later.